Assalamualaikum here. Hi everyone. I hope you all are having a wonderful week. And this is episode two for the blueprint of RCM. And um, I'd like to first of all thank every one of you that who supported the journey, who supported the series, and made wonderful comments out there. Got a lot of DM out there. Few things that I'd like to clarify before we get into the episode two is again I got a lot of DMs that please share the reasonable courses. I'd like to pay and start. Some of them said that when your course will be coming out and all this stuff. So, do you do one-on-one sessions and all this stuff? So yeah, one-on-one sessions can happen in the future, but really it depends upon the schedule. But since that's down the road, but uh, I don't think so. I can manage one-on-one sessions because I really have to take care of the firm and all that other stuff. But I guess what we can do, first of all, there's no paid courses videos are coming out. Do not expect that from my side. Being clear, just, so do not expect that out of me, that you'll be getting some courses or something like that. Everything is free, so you can go and learn by yourself. And these series will be actually here to make the legacy. If you'll be able to put every blood, sweat, and ounce that you have in in this industry, I believe you can get a very good result out of it and significant impact on yourself as well. And you don't need a paid course from my end, I believe. We can do this. We are just actually sharing the inside of based on our own personal, experience and everything. And I believe I could be the first one who's doing that right now. But I believe there will be more people who will start and do the initiative and they will start to creating this kind of videos, and I will be really happy to see those as well who will be start doing this, but eventually people will do that, and it requires a lot of effort, time, guts to share the personal experiences that you have been seeing, and everybody has their own journey, so you can learn from anywhere, learn from everybody that you can, even if you are looking for paid courses or something like that. I believe that's your choice. If you can get something out of this, it's wonderful. If not, stay where you are. I don't mind that either. But again, for those who are new to this industry, the episode two is basically for you guys, in which we'll be discussing about what exactly medical billing is all about. So I'll try myself to be as, I would say, convenient for you guys to explain this. We'll use the basic, plain language for this so you can understand better about it, especially for those who are just starting this industry who are not familiar with a lot of stuff with the doctors and healthcare. For you, it's new, so I will keep it very simple and efficient for you guys so you can learn about it. So, in terms of healthcare and medical billing, I would say it starts from every patient's visit. So, once a patient visits with the doctor, there's a hidden process start, and that's where we come in. It's called medical billing. As simple as that. The hidden process, we'll be also discussing that, obviously. So, uh, there are a lot of charts out there, RCM charts. You can learn about them on the Google. You can search them out, and you will find out that there's a lot of, I would say, information is already out there. But I'll my try my best to actually explain that in a very decent way, so you can learn more easier about this. So consider this um, as a imagination of yours that, let's just start from there. So once a patient visits the doctor and the doctor rendered the service to them, rendering means we usually use that terminology in healthcare, which means that provider will be providing services. And whenever I say a provider, it means that I'm discussing about a doctor who actually is a healthcare provider who's provide the services, right, to the patients. So if you have any kind of doubt on that, just clarify that, before we move further with these healthcare providers. So, so when a patient visited the doctor place, to the clinic, in the States, they obviously stop by checking their benefits, which means they will be verifying their information, about their insurance cards. So they will be needing their cards. They will ask them to sit down for a while and fill out a patient consent form, which is basically a form which requires their demos about their driving license, their insurance cards, and all that stuff. And they fill it out the form. It's a and it it's just for the HIPAA and other PHI purposes that the provider use it. And once that has been done, meanwhile, some of the front desk staff will be verifying either their insurance card is active or not, and whatever is something that they have to pay upfront for the doctor out of their pocket. The co-payments, co-insurances, deductibles, those are another situations for now. I wouldn't go in so much in deep into the co-payments, co-insurance. Just I'll give you a little brief about what it is actually. So consider co-payments as something that the patient needs to pay out of their pocket when they visit the doctor office. So, your insurance will be covering a lot of the percentage out of it. Let's just say 80% of the your charges will be taken care by the insurance of yours. But again, the 20%, 25% to 15%, that is going to be out of your pocket, and that is something which you need to pay upfront to the doctor. So the front desk will be also verifying that because every insurance has their own plans, every patient has their own plans, you know. So they will be verifying this either the card is active or not, and then once that has been done, they will actually allow them to see the doctor, right, so they can render the services. Once the doctor has been rendered the services, now the patient can go back to the home, and that's all. Their job has been done. They have seen the doctor and they're done. They will go back and for the medication and all this stuff. So but that's where our job starts, right? So we will be actually creating that claim, filling out a form, which is also known as CMS 1500 HECFA form, which is actually a form from our end that we send it out to the insurance. That it's a basic form, 33 columns. You can simply see it on the Google. It requires you know, it has three column, like I would say I divided into three, so it means that first column will be basically for the first section will be for the demos of the patient. Third will be, second will be for the provider's information. Third will be for the rendering services, like whatever, they have treated for, which means like, if I give you a little bit details about this too at the moment, so consider that in the States, it's more about the coding. It's about every diagnosis, every infection, every disease, and every treatment um, it's built in the codes. So, when we are taught, let's just say you got a cold, you visited the doctor's office, right? And so I would not go into too much depth about ICDs and CPDs, but I can tell you this, that consider the ICDs are the diagnosis, like whatever they find out, like you're having influenza, flu. So it means that there's a code for it. And, whatever the treatment they're giving you, or whatever the procedure they have done. Like, for example, let's just say they done a vaccine on you. So there's a CPD for that, code for the procedure. And we also need to mention that to the insurances because we cannot just mention all of those details. Obviously, doctors has their own progress notes and documentation that they do whatever they're learning from you about your disease and infection or so and so, whatever you're having. But again, in terms of codes, we'll just mention the codes and they will understand what we're exactly talking about. So we'll fill out those codes form and everything. We send it out to the clearinghouse. Clearinghouse, in a very decent and simple language, you can consider that as a bridge in between you and the insurance, right? As like a doctor and the insurance. So they are a double checker, I would say, to verify if the claim has some missing information, missing code, missing demos, or anything like that, and they feel that this claim needs to be get fixed, they will send it back to you instead of, you're getting the rejection from insurance, you get the rejection from or denial from the denial and rejection are two different things, but let's just talk about those later on. So if you got that from the clearinghouse, it will save you some time. You can, fix your whatever you made a mistake of, and you can resubmit that claim to the clearinghouse, and then they will send it to the insurance. You get paid. Once you get paid, the insurance will send you over a letter of saying the explanation of the benefits, and it means that the letter will have everything in detail, like whatever the insurance paid you for the as a doctor, and what are the services got paid, how much you got from each CPD, for each procedure, how much they paid you, and all those details. And then we will actually uh, paste those, you know, it's called payment posting in healthcare. It means that we will be posting those explanation of the benefits, all of those, whatever we got the reimbursement from each CPD and everything in the system of the doctor, to just let the doctor know what exactly he got paid or she got paid for, and we move on. So this looks like walk in a park, but again, it's not a walk in a park. It's a little bit difficult than it sounds, but again, if you do it for a few months, you will be quite familiar with it. You do it as day in, day out of yours, and it feels like you're doing a data entry sometimes. But again, I'm not saying that it's an easy job, but you can learn it, you can live with it, and you'll be just fine in a few months. And for the billers out there, I would say even coders, the credentialing specialists, and other departments try to challenge yourself for with other specialties out there. Go beyond your limit and learn on different specialties. It allow you to go in different states. It allows you to expand your caliber. It allows you to learn more from the other states. It actually keeps you, allows you to learn more from the different departments too. Do not just stick yourself, or if you're a good biller, learn a little bit more about credentialing. If you're a good credentialing specialist, learn a little bit more about coding, billing, that are the part of your industry. You should supposed to learn those departments. I have seen a lot of, in my cases, the biller doesn't know about credentialing. The credentialing specialist doesn't know about the billing. And they say proudly that this is not my department, which is probably makes sense for those who actually think it's right. I consider this wrong. I would say that I know you should supposed to spend your time in a department, learn out of it, learn by your heart and everything, be eager to learn everything. And that would take a lot of time. That might take a few years to just learn few states and, their regulations and their portals and all that stuff. But, you know, um, if you're familiar with that, you can actually learn others departments too. That will actually allow you to be good in the meetings, be more attentive in the meetings, so they can actually, you can understand what exactly the pain of the provider looks like. Either it's not just because of credentialing, either it could be from billing, either it could be just mistakes from the, coding side. But again, if you have that kind of a knowledge, it will allow you to understand them better, provide them tailored solutions, and become a consultant, right? So, if you ask me, for the 2 years of initially when I started this RCM industry, for the 2 years, I've been switched. I was bombarded and thrown in different departments, about 5 to 6 in the company that I used to work on, the firm, that I used to work, and they actually literally thrown me in different departments, like few months, and that was actually my I was very fortunate enough to do that because that allows me to learn more about every department, so I have seen those, ins and outs of those departments out there, about 5 to 6, then obviously, started learning more about the other departments too, but that allows you to have a basic understanding of every department, and it allows you to actually understand what the provider is facing through, what are their challenges look like, what exactly they are, being afraid of, and everything. And either sometimes it could be credentialing problems, sometimes it could be contracting issues, sometimes it could be coding problems and billing problems and all that stuff, but you will be have that understanding. And that's the whole reason of this series, to actually make you a consultant, actually to make you better. Some people are already good in this industry. It's wonderful. There's no obligation. You can, you can skip this part, skip this video, move to another one, or maybe send it to someone who actually needs it. Again, we are here to spread the knowledge out of based on our own expertise and experience, and directly for insights from the healthcare. So that's what we're doing. Um, at the love and the support that I got recently, that was supercalifragilisticexpialidocious. But I'll be happy to go on in the next video. In the next episode, we'll be going into more into the the skills that you'll be needing to make money. And once you're starting learning the skills, and if you put your blood, sweat, and every ounce of it into this industry or some departments of this industry. Honestly speaking, we all will be ending up by creating our own legacy, and that's the plan that I have for you guys to actually make something good out of you and help you guys to grow more. I hope I will be able to in a very, I could explain, I have explained about the medical billing itself in a very easier way so you guys can understand it. But again, you have to learn it, share your experiences in the comments, and let me know if when you started the industry, what was your challenges looks like into the revenue cycle management and how you become a good biller now, even credentialing specialist, coder, what was your experience and everything that allow us others to actually see, you know, that how you're actually, here by doing some efforts. So let's talk in the next video. I'll hope that I have keep this very precise because I thought the last one was a little bit longer than the usual one. So I was just trying to keep this a little bit more precise and visible for you to understand. And in the next video, we will be covering a lot of other aspects and making sure that this series will give you enough knowledge to understand the industry, learn about those departments out there, learn how to communicate, how to hunt the clients, how to reach out to doctors. I wouldn't say hunt would, but how you can serve the healthcare providers out there and how you can be beneficial for them and make a win-win for, all of us. So that's what we're looking here, forward to. And I hope to see you guys in the next video very soon, inshallah. And wish you very, very luck. And Eid Mubarak for those who are going to spend the Eid, obviously, yeah, Muslim friends and every, family that I have. And I wish you guys a wonderful Eid and very, very success to you and your family, love and affection and joy. And I'll see you guys in the next video. If you have any questions, if you got something that we need to discuss in the next video with the topic, let me know. I'll be happy to share a little bit on that. I'll try my best to do this every week again because meanwhile I do this, the sessions because I love to, guide people, educate people the way and train people because this is something which I do every day and honestly I love it. But again, um, I get a lot of, in terms of less time to doing when recording all this stuff because I have a phone that I need to take care of. So I'll try my best to do it every weekly, like every week or so. But again, it will be give us more time to listen about you guys and see how the series are going and help you out in any manner possible for us to do so and build something together. So that's has been said. Let's just see you guys in the next episode, and you all have a wonderful week ahead. Work hard, be eager to learn, and put yourself in a shoe where you'll be, you know, running for the long run. Yeah, all right, guys, have a wonderful day. Look forward to seeing you soon. Have a good day.